Good morning. All right, now we are going to get started. Thank you all so much for joining us here today, and for those of us that are joining via live stream, we are so excited for our third open enrollment ACA kickoff event as we head into open enrollment beginning on November 1st. And just want to start by saying thanks to everyone in this room for not just being here, but for being present and being active for the past two open enrollment periods and for this upcoming deeply important open enrollment period. To kick us off this morning, I'm thrilled and honored to introduce the Secretary of the U.S. Department of Health and Human Services, an incredible champion and our fearless leader in all of this work, Secretary Sylvia Matthews-Burwell.
Good morning, and thank you, Bess. Want to welcome everyone. I am very happy to join you all this morning to kick us off for what is one of the biggest and most important efforts that we do at HHS, and that is open enrollment. Over the last 5 years, you all have been tireless advocates for quality, affordable health care. And with your support, we've been able to make historic progress for the American people. You are the engine that makes open enrollments possible, and we are grateful for all of your partnerships. And Americans across this nation are grateful as well. People like Nathan Aldridge, who I met last March. Nathan beat cancer in 2006, a brain tumor that doctors found while he was a senior in college. But having that in his medical history and later developing narcolepsy meant that affording health insurance was nearly impossible for him. But thanks to the Affordable Care Act and the work of tireless advocates like yourself, Nathan found a plan on the marketplace last year that cut his monthly premium from $500 to just $100 and reduced his deductible by thousands of dollars, and his narcolepsy medication, which had cost him $1,200 every month, now only costs him $10. When he was asked about getting covered, Nathan said, "How incredible it is to not have the crushing burden of medical expenses." As you know, since the Affordable Care Act took effect, an estimated 17.6 million Americans, just like Nathan, have found coverage and are no longer uninsured. With these gains, we've reached the lowest levels of uninsured on record. And the progress we made just isn't about getting coverage. Thanks to the new protections, like preventative services at no extra cost, everyone's insurance is better, no matter where they buy it. Families across the country can now rest a little easier knowing that they can't be dropped just because they get sick or discriminated against if they have a pre-existing condition. With your support, we've delivered impact. Somewhere in this country right now, there's a mother whose family is celebrating that she is cancer-free because of an early diagnosis. There's an entrepreneur out there who's starting a new business knowing that she can afford her insurance without the help of an employer. And people all over the nation aren't worried about falling into debt just because they get sick. Together, we have taken one of the most important steps forward in decades and begun to transform our healthcare system. But we're not finished yet, and that's why we're here today. As you know, open enrollment starts November 1st and runs till the end of January. And it's going to be more challenging than years past. With our historic gains in coverage and an improving economy, there are fewer uninsured to enroll. And our researchers tell us they're going to be a little harder to reach. Many of the uninsured are younger, and they come from underserved communities. They're worried about costs, and many don't know about the financial assistance that's available to them. Ultimately, having fewer uninsured is a good problem to have, but it means we're going to have to work smarter and harder than ever. This year, we have the data tools to reach the right people in the right way. We're targeting our outreach and our messaging with more localized campaigns in both English and Spanish to make sure we get the people the information they need to make the right decisions for their families. And we're focused on putting the consumer at the center. What does that mean? First, making sure that they know that that financial assistance is available. Second, We've made it easier to sign up in a number of ways. And third, we need people to know that there are people who are available to help them. And we have good data to back these up. Almost 8 in 10 of the uninsured who sign up for the marketplace have an income that qualifies them for financial assistance. We're always working hard to improve the consumer experience, and with upgrades to the site and with more tools to help people find what they're looking for. And we'll have more details on that from Lori Lotus. We're streamlining healthcare.gov to make it more intuitive and simpler, and we'll be providing better support to make sure that we're communicating with our customers through the mediums they are most comfortable with, using email, social media, text messages, phone calls, and digital advertising. We want to make this as easy as possible for families to find the right plan at the right price. And we're counting on all of you all to help us meet this goal. Open enrollment is less than 2 weeks away, and that's where you all come in. We need your help to spread the word. You are trusted voices, and you know how to reach your communities better than anyone else. Use your networks and your connections. For social media, we're using #GetCovered, so please join us on Twitter, Facebook, Instagram, and other social media platforms. Every tweet, post, and social media graphic makes a difference, especially as we are trying to reach younger audiences, which we know disproportionately those that are eligible are. We ask that you host a press conference to kick off open enrollment and record a PSA if you can. Stephanie Owens and our regional offices stand ready to help develop strategies and support your efforts with ACA toolkits, one-pagers, targeting information, and more. So whether you're located here in DC or anywhere else in the nation, let us know how we can support you. You all are the key to our success, and we are counting on your continued leadership and innovation as we have in the years past. On behalf of our team at HHS and all those that we serve together, thank you so much for the work you've done over the past 2 open enrollments and before, as well as the work you're going to do now. Together, we have given security and peace of mind and access to life-saving care to millions of Americans. Together, we've saved lives and delivered impact across this entire nation. I look forward to all that we're going to do together in this open enrollment, and thank you all very much.
Thank you so much, Secretary Burwell. It is now my pleasure to turn the microphone over to Lori Lotus, who is the Director of Communications at CMS, and the moment we've all been waiting for, a website demo.
Good morning, everyone. So here's what I want to do. I want to do a couple of things. One, to walk you through some of the consumer improvements, and then 2, give you a walkthrough of window shopping, which we just launched late last night. So as of right now, people can go on to healthcare.gov and they can shop plans and look at how much it's going to be for it to have a plan in their area based on just answering a few simple questions. So first off, as the Secretary said, we are not very far off from open enrollment starting at all. 6 days, which we are counting every single moment because we have a lot to do in this next week so that we are up and ready and everything's rearing to go. So we have a few goals when we've set out to approach how we're approaching OE3. And so number 1, and you heard the Secretary mention all of this, number 1 is to make sure that we're doing everything we can to keep our current consumers so that we're bringing people back to the marketplace. They like their coverage, they want to keep it, and so that's our first goal. Number 2 is to continue to bring new consumers into the marketplace. So the 17.6 million people that we've insured, making sure that we're actually growing that number and getting more people into the marketplace. And number 3, and that's what I'm going to spend my time talking about today, is really about what we're doing to make the experience even easier for consumers, because that's where we're at. We're putting the consumer at the center, and that means everything that we're doing is focused on the consumer. What can we do to make their experience easier, to make it so they better understand their options. And there's a lot we've done this year. There's going to be a lot more we do in the next year, but we at least wanted to give you a little bit of a walkthrough of what you're going to be seeing on November 1st. So this is going to be the new homepage. And one of the things that we did last year is if you were a new consumer, if you were a current consumer, you basically had the same experience, right? There was one way in and you went down that pathway. What we learned is if for returning consumers, it was a little confusing for them. They got hung up in a few places because the experience was really almost for a new consumer. So now you can see even from the homepage, there's going to be 2 different entryways, if you are new or if you are returning, and you go down each one. The next thing is, and I just want to give you a couple of examples of how it looks new or how it looks different in the different types of content we have, especially for those who are returning. So this is one of the first things that somebody who is returning sees. And it basically gives a checklist, but it gives a checklist that's specific to their situation, right? They currently have coverage, and we want them to answer a few simple questions to think about their situation to make sure that, one, do they want to stay in their same plan? We're really recommending that everybody shop because we know that they could save money if they do shop, and maybe they could get a plan that better meets their health needs and better meets their budget needs. So this sort of lays out what returning consumers really need to think about. Another thing is that this is what the plan, when people get their eligibility results and they start shopping, this is what it looked like last year. So if you're a returning consumer, you needed to enter a 14-digit ID. And that 14-digit ID would show you your plan, and then you could shop and compare. This year, we have their plans saved for them already. So you don't need to enter your 14-digit ID. When somebody logs into healthcare.gov, they log into their account, they start to, they want to walk through the process, we tell them right up front, great news, we have your plan for you. Take a look. It'll be saved. You can compare it against other plans. But that way, the information is right there for them. Eligibility results. So this is a really big change this year. So this is what it looked like last year. And so you fill out your application, and then you get your eligibility results. And this is what tells you, what type of coverage do I qualify for? Do I qualify for Marketplace? Does my child qualify for CHIP? How much are my tax credits? Was there a data inconsistency created by somehow not entering the right information? So to get all of that information, you needed to click on View Eligibility Results. 1 in 4 people did not do this. Not to mention that other people probably, when they downloaded that PDF, they might have not gotten through all of the pages. So what we did this year, and you're not going to be able to see it very well, so what we did this year, right now, when somebody clicks, when they submit their application, this is what they see. They see everything on screen. So the first thing they see is what family member qualifies for what type of coverage. So Anna Carson is the child of John and Suzanne Carson. She qualifies for CHIP, and John and Suzanne qualify for Marketplace coverage. It then has the amount of APTC or tax credit that the individual or that the family qualifies for. Next, it tells you whether or not you qualify for a cost-sharing reduction. And if you do, that you need to choose a silver plan in order to get that cost-sharing reduction. And we've really tried to emphasize this in more of the content when somebody is going through the site, making sure that they know their options. A lot of people who do qualify for silver plans end up not choosing a silver plan, so we want to make sure that they understand that they may be able to save even more money if they do choose a silver. And then fourth, and this is really important, if there is a data inconsistency created, so if somebody doesn't enter the social security number, if someone doesn't enter their immigration documents, if someone gets their social security number wrong, this says that your eligibility is temporary, and that means you need to come back and do something else in order to have to maintain your coverage. And this, we believe, will be super important so that we can make sure that people know if they've done something, if they haven't given us all of the information, that they need to take another step so that we can make sure that they have coverage throughout. So this is just, I should have clicked over here. So this pops it up a little bit bigger so you can see. So we're also taking another couple of steps, and actually these have been implemented for a while now. So if somebody chooses not to enter their social security number, that's one of the reasons why we had quite a few data inconsistencies. Now, if somebody doesn't enter it, there's a pop-up modal that says you really need to enter your social security number. If you don't, your eligibility will be temporary. So we've already seen this working really well, just giving people more information to let them know what this means for them, because we want to do everything we can to make sure that people are taking the steps that they need to get their coverage. So I'm going to then now switch over. So give me 2 seconds to show you window shopping. Bess, how do I make this come up? Bess Evans. Do you know how I get the...
Sorry, this room is a vault, and I was trying to send the photos of all of you.
Do you know how I get this to pop up?
Let's see here.
We actually did test this before we...
We did. Man in the room behind that mirror. Help. Let's see if we just... Does it still go if it's this, or did it come undone entirely? It came undone entirely. That's what's going on here.
Well, let's see. Let's get back to this.
No, but that's not working either.
No, I think it will.
Oh, there we go.
That's not what we want, though.
No. Yeah, it's just not,
We want to go to Chrome. Yeah.
that's not popping up. It just goes to that.
Aha!
Huh.
Okay, so it's like a different screen.
Okay.
Okay.
Where is it now from my screen?
So you might have to look at the screen. Sorry.
Oh, but that's not the...
Okay.
Can we get a healthcare.gov? I don't think... I actually don't think this will work without me having access to it. So why don't we actually have Stephanie come up and speak while I go through window shopping down here, and then we'll pop it back up so you can see. Because the one thing I do want to show you, we've changed a little bit of the design and the layout for window shopping, or to see your plans and prices. But the big thing that's different right off the bat is that it will show you, answer a few questions, you enter your zip code, information about your family, and then there's a question that asks if you want an estimation of your out-of-pocket cost. And if you choose yes, then you answer a question that's basically, you decide how much you use your healthcare, right? Low, medium, or high. Medium is sort of the standard. I see a doctor, I can't remember how many times, like 3 to 5 times. I have this many prescriptions. And so and you answer that question for each of the family members in the household, and it will give you an estimated out-of-pocket cost, so your premiums, your co-pays, your deductibles of how much you're going to spend for a year. And this is information that we think is super important to give people, because we know that when consumers are looking for coverage, they're not just looking at premiums. They want to better understand what does this all mean? We will have other tools launching in the next couple of weeks. And so one will, same sort of setup, you'll answer a couple of questions, and then you'll be able to input your doctor, your prescription drug, your facility, and it will tell you which of your plans, what drugs are covered, what drugs are covered, what providers are covered. And just to give, back to what I was saying about giving consumers information, what this does is we're trying to empower consumers. We know that they need more information sometimes, and they want to better understand what their health coverage means for them and what their options are. And so what we're doing is additional steps to really give them that information. So we're going to skip this.
Great.
But healthcare.gov, you can go there now and you can play around, enter your zip code, and walk through the tool. Thank you.
Right. Oh, this is done. Okay, great. All right. The good news is that it's just me that's not working. That's good. It's not anything else here. All right, Stephanie, we'll have you come up now to talk a little bit about our stakeholder engagement for Open Enrollment 3.
I'm not going to make this a technology roadshow because I am really not the best person for this. So Good morning, everyone. I am Stephanie Owens. I'm the Deputy Director of HHS's Office of Intergovernmental and External Affairs. And we're so excited that you're all here this morning. So many of you I've had the opportunity to meet over the past several weeks as we've talked about this upcoming open enrollment and some of the really exciting things that you're going to do. So I'd like to talk just a little bit about our stakeholder engagement broadly, and then talk specifically about some other things you might think about doing if you haven't done so already. Oh, I did it, yes. So our ultimate goal, as the Secretary mentioned, was to be able to reach much more deeply into communities, neighborhoods, organizations in a much more strategic fashion. We know a little bit about who's left that have not yet enrolled in insurance. They didn't enroll the first year, they didn't enroll the second year, and so we know this year they're going to be a little bit harder to get. We know that about 19% of them are African American. We know that many of them, over half, are men. We know that they are in a lot of the major urban areas that you would think about, like Dallas and Houston and Miami. We also know that there are many of them in rural communities as well. And so we want your help in thinking about ways that we can be much more strategic and target some of our tactics toward different communities and different geographies. To date, we've worked with about 150 partners who have made 75 different organizational commitments to engage in some of our efforts. Some of those commitments are based on social media, based on doing events, and some of those commitments even include acting as surrogates, doing op-eds and other kinds of activities that would increase our earned media. On the ground, we have 70 local coalitions. So these are market-based coalitions. So for those of you with very wide or narrow national networks and you want to plug in on the local level, we will be able to connect you with our regional offices, and those regional offices will be able to connect you with some of these local coalitions on the ground. The coalitions include our family of assisters. So we have our navigators, we have our certified application counselors, we have champions for change who are just our friends out there in the community, making sure that they spread the word, raise awareness about enrollment, about also using your coverage. And we also have agents and brokers who work with us in many of the different markets on helping to get people enrolled. And then last but not least, it's your organization. So we have a very wide variety of community organizations, neighborhood organizations. We have business, both large and small businesses, sitting at the table, everyone helping to engage consumers from their own particular point of reference or sphere of influence. So this is how our regions look across the nation. I will tell you that regions 4 and 6 are the regions that have the highest number of QHP eligible uninsured. And the QHP eligible uninsured are those that we know are eligible for a plan on the marketplace. So 5 ways to take action. Someone tried to help me do the math, because along with technology, math is not my strong suit either, but all of your organizations and the reach that you have is over 2 million people. And in some instances, there are some other organizations whose reach, because of the other partner organizations that they work with, take us well beyond that. So please email your list. And you know what your people want to hear from you. We simply want you to share the messages of open enrollment. We want you to share the deadlines that really drive people to action. But as you think about the specific groups that you work with, think about how you tailor those messages so that they resonate with your constituents. Hard copy material, we have material available on Marketplace, wait, help me. We'll send you a link. It's marketplace.healthcare.gov, but we'll actually send you a link on where you can order those materials. But we have materials that are already prepared. But more importantly, we also have templates. So you can customize materials again to meet the needs of your particular audience. Church bulletins, any other information that you share, your websites, we have widgets that you can put on your websites that will take people directly to healthcare.gov for open enrollment. So all of these tools are available to you, and we will send a follow-up email that has specific links to each and every one of them. Again, hosting an enrollment event. And the first years we did these really big events with thousands of people. And one of the things that we recognize is while that's a really great way to share information, sometimes smaller, more localized events in your communities are actually the best ways to get people involved. So we would encourage you, if you haven't done so already, to please think about a couple of places where you would be willing to host an enrollment event. Share your information or your space. And so for those of you who have facilities in communities and you can make some time available for a navigator or an assister to come and provide the technical capacity to do the enrollment, we will certainly, through our regional offices, match you with the assisters who can then utilize the space that you would make available. And then last but not least, join the conversation online. Have this, for those of you who are active on Twitter or other forms of social media, please engage around the issue. For those of you with communications departments, my colleagues on the media team will be talking a little bit later, and we'll talk about how to connect from that perspective as well. Other ways to take action. So tell your story. We're at the point now where it is getting harder to reach people, and we know that we've put a lot of information out there, but you are the trusted voices, and people want to hear from you. So tell people why it matters. I'm going to take 2 minutes. I'm going to tell you my story. So I am a cancer survivor, but I am a cancer survivor with amazing insurance. I have always had excellent insurance. But during my journey, no matter what step of the road, inevitably I ran into someone who did not have my same fortune. And to listen to those conversations about people not having coverage or having coverage but not being able to connect with the right care was heartbreaking for a person who's working in this space. So I know that each and every one of you has been impacted in some way by health. And your story is just as important as mine. So please take the time to share it. Maybe not necessarily with your colleagues or on live stream, but take the time to share it with your friends, with your family, with others who will then be encouraged perhaps to share their story. If you're interested, we can turn your story into a blog post. Your story can be posted online. If you want to raise the voice of why this is so important to you, please don't hesitate to reach out to us to let us know. We've talked about a few of these other things. I'm going to talk about themes in closing, but I would then ask you, who's missing? So if you look around the room, you will see some amazing organizations doing a lot of great work. But we know this year is tougher. So when you think about it, who else could be in this room with us? What other organizations are touching thousands of people and maybe even tens of people just right in your own communities. So I would encourage you to think about what other organizations we could bring into this conversation to get them engaged as well. Last, I want to close with our theme week. So these are national opportunities for everyone to organize around an issue or theme at the same time. And I will start with next week, which is our kickoff week. It's the first week of enrollment. It is not listed because we know that everyone is working really, really, really hard to make sure that they are hosting kickoff events and other activities to really energize people around the time frame of being able to enroll in healthcare. The week of November 9th is our Women's Week of Action, and it leads into our first Faith Weekend of Action. We use the second Sunday of every month as sort of a marker around faith, and that entire weekend through faith organizations, we encourage people to do enrollment events and activities. I won't read through all of these for you. I will just highlight that there are a couple of really key deadlines. The deadline of December 15th. That's the first deadline to ensure that you can have coverage for the first of the year. So we're really trying to make sure that everyone is enrolled before that time. And then you'll see other deadlines in January and other weeks of action. There may be something that your organization does or something that you're aware of that we aren't thinking about that would be an excellent weekend of action or day of action. And if so, please let us know. We'd love to add that information to the work that we're doing. So in closing, I just want to say thank you so much for your time. Thank you for all that you've done, and we look forward to continuing to work with you. Bess?